the Ball newspaper. Make sure you grab a copy for yourself. Now, when a medical emergency strikes, every second matters. But even with sirens blaring, ambulances are too often delayed by motorists who fail to give way, costing precious time that can mean the difference between life and death. Far from being just emergency transport, modern ambulances are mobile intensive care units equipped with advanced life-saving technology and staffed by highly trained medical professionals who begin treating patients long before they reach hospital. This week on Health Digest, our health and science reporter Gloria Milimu goes inside one of these mobile emergency units to examine the vital role ambulances play in emergency evacuations and why making way for them could help save a life.
When an emergency strikes, every second counts. And for a patient in critical condition, the difference between life and death is measured not in hours or days, but in seconds. Standing between tragedy and survival is the ambulance, which provides a service many people take for granted. More than just vehicles with flashing lights and sirens, ambulances are mobile hospitals, bringing life-saving treatment directly to patients while racing against time to get them to definitive care. Modern ambulances are equipped with sophisticated medical equipment designed to stabilize critically ill patients before they even reach hospital. From advanced life support systems to emergency medication, every piece of equipment on board serves a critical purpose. Paramedic Kamar Hussein explains the life-saving capabilities of one of their most advanced emergency vehicles.
This is an ambulance that is able to sustain life for any patient who is not able to breathe for themselves. So the reason why it's called an ALS is the fact that this ambulance has a machine that is called a mechanical ventilator. And what it does is for any patient who's not able to breathe on their own, this equipment helps in ensuring that this person gets enough oxygen in their system.
The ambulance also carries a reliable support of medical oxygen for patients who have been intubated and rely entirely on assisted breathing. It is fitted with a defibrillator used to restart the heart during cardiac arrest, a suction machine to clear blocked airways for patients unable to cough out secretions, intravenous fluids for emergency treatment, and a drug box stocked exclusively with emergency medication. Patient safety is equally a priority.
And then, as you've seen, it has the rail guards, which prevents the patient from falling down. Again, when you're carrying a patient who you suspect has spinal injury, you don't put them directly on the mattress. You already put them on the spine board. You've secured the head. You've used the blocks to secure the head and something called a cervical collar. So once you support the neck and then you fasten the patient comfortably on the stretcher, regardless of maybe how bad the road is, the patient will have very minimal movement.
The difference between an advanced ambulance and a basic ambulance lies in the level of care each can provide. While advanced ambulances are equipped to manage critically ill patients with equipment such as mechanical ventilators, basic ambulances are intended for less complex emergencies and patient transfers. Emergency medical services are not limited to the road. Depending on the terrain, urgency and location of the patient, evacuations can be carried out using road ambulances, air ambulances, or even water ambulances, ensuring patients can access emergency care wherever they are. Dr. David Kariuki, CEO of the Kenya Medical Practitioners and Dentists Council, explains.
Within it, one can be able to be provided services that ensure that their life or emergency that they have is stabilized. So an ambulance can be used for several reasons. One, to stabilize and transfer the patient to the nearest health facility.
Paramedic Hussein says that their ambulances respond to as many as 30 emergency evacuation calls every day. But the types of emergencies vary across the country. She further explains that they evacuate more female patients than male.
Like, for example, we have ambulances in Garissa County. So for Garissa County, most of the calls are consist of, say, maternal issues. So these are deliveries. That is the biggest calls we do. And then we have ambulances in Narok as well. So for those ones, most of the conditions that we deal with is renal issues. Yeah, those are kidney issues. So Kakamega, same. For the people who are in Kakamega, the most calls they do is deliveries. Yes. So, but within Nairobi, we get so many types of calls. We can't specifically say one is higher than the other, but we have more medical cases than surgical cases within Nairobi.
As demand for emergency medical services continue to grow, ensuring every ambulance meets minimum safety standards has become increasingly important.
What moves people to the hospital are ambulances. And we realize that ambulances and ambulance service has previously not been regulated in this country.
Accreditation is a critical safeguard that ensures ambulances are properly equipped, roadworthy, and staffed by qualified personnel capable of delivering emergency care safely and effectively. According to the Kenya Medical Practitioners and Dentists Council, more than 100 ambulances have so far been authorized to provide emergency medical services after meeting the country's legal and regulatory standards out of approximately 180 applications received.
Internally, once it is confirmed that it is in good mobile condition, then we now confirm that it has the necessary medical equipment, tools, medicines to be able to provide services.
For patients in critical condition, the journey to survival often begins long before they arrive at a hospital. Inside an ambulance, trained emergency personnel, specialized medical equipment, and every passing second come together in a race against time. And as these emergency vehicles navigate through traffic with sirens blaring, the simple decision by motorists to give way could be the difference between life and death for someone desperately waiting for help. Gloria Milimu, KTN.
Fear and anxiety